Hey, have you ever really stopped to think about just the absolute marvel of a baby arriving?
It really is something.
Yeah, it's this, fundamental human thing. But when you actually dig into what's going on, wow, it's just an explosion of biology in these really pivotal moments.
Absolutely. And that's exactly what we're doing today, taking a deep dive into that journey, birth, the newborn itself, and all the crucial stuff around this foundational time. We're drawing on some lecture materials here that cover, well, everything from the first hormonal signals to what these brand new humans can surprisingly do.
Right. And our mission, like always, is to sift through all that potential information overload. We'll pull out the really vital and honestly the most kind of mind-blowing insights, give you a clear picture without drowning you in tiny details. Okay, so let's unpack this. Where does this whole incredible thing actually start?
Well, the beginning of labor, it's this really fascinating cascade of hormones, usually kicks off around 266 days after conception.
Okay.
A really key player early on is something called corticotropin-releasing hormones, CRH.
CRH.
Yeah. And that hormone basically sets off a chain reaction, triggers other hormones that get the body ready.
And that leads to oxytocin, right? Isn't that the one everyone talks about with birth?
That's the one, exactly. The mother's pituitary gland starts releasing more and more oxytocin. And as that concentration goes up, it starts those uterine contractions.
So those first twinges, that's the signal.
That's the signal. The process leading to birth has officially begun. The source material we looked at even has a figure, 4.1, I think, showing the 3 stages of labor visually. We're not getting into the nitty-gritty of each stage today, but it's there in the background.
Got it. So hormones are like the starting gun. Okay, let's jump forward then to that, the big moment everyone's waiting for, the baby actually arriving. What defines that precise instant?
The technical moment of birth is when the baby is completely out of the mother's body. And what's just incredible in almost every case is that the newborn immediately starts using its lungs, breathing air. It's an instant critical switch from, living in fluid to breathing air on their own.
That first breath. It's almost hard to wrap your head around that change.
Yeah.
And then right away, there's that standard check they do, isn't there? The APGAR score.
Yes, the APGAR scale. It's a standard system, really quick way to evaluate the newborn's general health right after they're born.
Okay.
It's scored 0 to 10 higher is better, and they usually do it at 1 minute and then again at 5 minutes after birth.
And what are they actually looking at when they do that score?
It covers 5 basic things, and the acronym EPGAR helps remember them. Appearance, that's skin color, basically checking oxygenation. Pulse, heart rate. Grimace, which is about their reflex response. Activity, so muscle tone, and respiration, their breathing effort.
Okay.
Each gets a score, add them up, and gets a quick overall picture of how the baby's doing right then. Appearance, pulse, grimace, activity, respiration, vital signs, neurological function, physical status, breathing. It covers the basics fast.
Makes total sense, a rapid health check. And beyond that immediate score, there's also more detailed medical screening pretty early on, too.
Oh, absolutely. Medical tech has come so far. We can now screen newborns for literally hundreds of different genetic and metabolic disorders.
Hundreds.
Usually just involves a tiny blood sample, often just from a little prick on the baby's heel.
Wow.
Think about that. One tiny heel prick can flag conditions that, if you catch them super early, can completely change a child's life, prevent really severe disabilities, sometimes even death.
That's just incredible.
Yeah, for some conditions, early treatment has boosted survival rates from almost 0 to over 90%.
The power of catching things early. Amazing. Okay, what about those very first moments, the physical stuff? I imagine there's a lot going on right after birth.
Yeah, there's usually that initial health check and cleaning. And you might notice some things like vernix. That's the sort of white, waxy stuff that protected their skin inside. Or maybe lanugo, which is this very fine, downy hair some babies have. Puffy eyes are also pretty common right at the start.
Okay. And what about bonding? We hear so much about that immediate connection. Is it as sort of make or break critical as people sometimes say?
Well, the research suggests maybe not in a strict critical period sense. If you don't have skin to skin right that second, it doesn't mean healthy development is impossible later on.
Okay, that's interesting.
But what is definitely important is that early gentle touch, massage, that kind of physical stimulation, it actually helps release chemicals in the baby's brain that promote growth and well-being.
Nah.
So maybe the deep emotional bond builds over time, but those first physical interactions, they have real immediate biological pluses. It does kind of challenge that idea that it has to happen instantly.
That's a really important nuance. Okay, changing gears a bit. The sources also talk about different ways people approach childbirth. It sounds like there isn't one single best way.
Exactly right. Research just hasn't shown that any one specific procedure is significantly better across the board than others. What's best is really personal, depends on the mother's health, her preferences, the situation, the baby's condition.
Right. So what are some of those other approaches people might choose?
Well, the materials mention things like Lamaze that focuses a lot on breathing techniques and relaxation to manage pain.
Uh-huh.
Then there's the Bradley method, which is more about partner coaching, aiming for a really natural birth. Hypnobirthing uses self-hypnosis, deep relaxation, and even water birthing is mentioned.
Different philosophies there.
Yeah, Lamaze is about managing pain with breathing. Bradley method is often about an unmedicated birth with partner support. It really shows how personal it all is.
And who helps out? What kinds of professionals might be involved?
The main ones you'd encounter are obstetricians, medical doctors specializing in pregnancy and birth.
Right, OBs.
Midwives, who provide care through pregnancy, labor, birth, and postpartum. And doulas, they offer continuous support, emotional, physical, informational, through the whole process.
Good to know there are different kinds of support. Now, the thing that always comes up, pain. The sources say it's very subjective.
Absolutely. Pain itself is defined as a subjective psychological thing. You can't just hook someone up to a machine and get an objective pain number. How someone experiences and interprets labor pain varies hugely, so it's tough to make broad statements about it.
Which naturally brings us to pain relief, like anesthesia. Epidurals are pretty common, I gather.
Yes, using medication during labor is common in many places. There are pros and cons, obviously, that get weighed carefully. But yeah, something like 70% of women who get anesthesia during labor choose an epidural.
Wow, 70%?
Yeah, it numbs the lower body, offers significant pain relief, and now there are also options like walking epidurals, which use lower doses, allowing a bit more movement.
Interesting. Things keep evolving. And after the birth itself, how long do people usually stay in the hospital?
It varies quite a bit. Depends on the type of birth, vaginal, or C-section mom and baby's health hospital policies.
Sure.
But studies have shown that mothers often report being more satisfied with their care overall if they have a slightly longer hospital stay compared to being sent home really quickly, like after just a day.
That makes sense. Gives more time for support.
Yeah, and actually recognizing how important that immediate postpartum time is, the U.S. Congress passed a law requiring at least a 48-hour stay for uncomplicated vaginal births.
That definitely underscores how key those first couple of days are. Now, unfortunately, things don't always go perfectly smoothly. The sources also cover potential birth complications. What are the main categories?
Right, we need to talk about preterm infants, those born before 38 weeks gestation, and low birth weight infants weighing less than 2,500 grams, that's about 5.5 pounds. Then there are small for gestational age infants. They weigh less than 90% of the average for their gestational age, which suggests maybe they didn't grow as expected inside.
I remember reading about very low birth weight. That sounds especially serious.
It is. Very low birth weight infants are under 1,500 grams, about 3.3 pounds, or born before 30 weeks. These babies are really vulnerable because their organ systems just aren't fully mature yet.
Right.
The age of viability, that's the earliest point a baby born early might survive with a lot of medical help, is generally considered around 22 weeks now.
Wow.
But it's amazing. Survival rates for preterm infants have shot up dramatically over the last few decades. Things like surfactant therapy for lungs, better ventilation.
Yeah.
It's made a huge difference.
That's incredible progress.
Yeah, I mean, think about it. Decades ago, a baby at 28 weeks had a pretty slim chance. Now, survival rates are often over 90% for that age.
So what causes babies to be born preterm or low weight? Is it always clear?
Often, no. There isn't always one single obvious cause. But researchers look at lots of potential factors. Maybe issues with the mother's reproductive system, having twins or triplets, the mother's general health during pregnancy. Ethnicity seems to play a role, mother's age, lifestyle factors like smoking or substance use, maybe even some environmental things. It's complex.
And then there's the opposite problem, right? Post-mature babies.
That's right. Post-mature infants are those still in the womb 2 weeks or more past the due date. And interestingly, the problems linked to being post-mature, like maybe getting too large for an easy delivery, are often more preventable with careful monitoring and maybe inducing labor compared to the complexities of preterm birth.
Okay. Now, sometimes a vaginal birth just isn't the safest route. That's where a cesarean delivery comes in.
Exactly. A cesarean or C-section is a surgical procedure. The baby is delivered through incisions in the mother's abdomen and uterus, bypassing the birth canal entirely.
And why would that be needed?
The most common reason is fetal distress signs the baby isn't handling labor well, and a vaginal delivery might be too risky.
Okay.
Other reasons include breech presentation, baby being feet or bottom first instead of head down, and also the increased use of electronic fetal monitoring over the years seems to have contributed to rising C-section rates.
Right.
It's important to remember, though, it is major surgery, and like any surgery, it carries certain risks for both the mother and the baby.
A significant intervention, definitely. Sadly, even with all the medical advances, we do have to touch on the tough subject of infant mortality.
Yes, it's somber, but important to understand. Stillbirth is when a baby is delivered showing no signs of life. Thankfully, that's pretty rare, fewer than 1 in 100 deliveries.
Okay.
Infant mortality means the death of a live-born baby before their first birthday. And our source material points to a figure, 4.6, I believe, highlighting that race plays a significant role in these rates. Which really underscores that it's not just biology, socioeconomic factors, access to care, systemic issues. They likely play a big part. It's an area of ongoing concern and research.
Yeah, those disparities are really stark reminders of ongoing inequities.
Absolutely.
The sources also quickly mention support for new parents, like leave policies.
Yes, in the U.S., there's the Family and Medical Leave Act, FMLA. It requires most employers to give eligible employees up to 12 weeks of unpaid leave for certain family and medical reasons.
Right.
That includes the birth and care of a newborn or adopting a child, but also for an employee's own serious health issue or caring for a seriously ill family member. That leave can be so crucial for recovery and bonding, even if it's unpaid.
That time off, even unpaid, can be vital. Now, recovery isn't just physical, right? There's also the issue of postpartum depression.
Right. Postpartum depression, it's a period of really intense sadness, anxiety, fatigue after childbirth. It's definitely more than just the baby blues, which are pretty common and related to hormone shifts. This is more severe, lasts longer. It affects about 10% of new mothers. And in rare cases, maybe 1 in 500, it can become postpartum psychosis involving a break from reality.
Wow, 10% is significant. What triggers it?
It can be linked to those big hormonal swings after birth, the sheer emotional and physical load of having a newborn. It also seems more likely in women with a history of depression, or perhaps those who felt unprepared for the emotional side of birth and new parenthood. Getting support and treatment is so important.
Absolutely crucial.
Yeah.
Okay, let's shift focus now to the newborn, this amazing little being. It's easy to think of them as just helpless. But the source talks about the competent newborn. What does that mean?
It means that even though they look fragile and need constant care, newborns actually arrive with this surprisingly sophisticated toolkit of abilities. Across all areas, physical, cognitive, social, they're way more capable of interacting and learning than we might think at first glance.
Like reflexes, for instance, those automatic responses.
Exactly. Reflexes are unlearned, involuntary reactions to specific stimuli. Think about the sucking reflex vital for eating.
Right.
Or the swallowing reflex. Or the rooting reflex. You touch their cheek, they turn their head and open their mouth looking for the nipple. These are hardwired for survival in those first weeks.
So important for getting started. The sources also mention neonatal jaundice. What's that about?
Ah, yes, jaundice. It's pretty common. It's when the baby's skin and the whites of their eyes look a bit yellowish.
Why does that happen?
It's usually because their liver isn't quite mature enough yet to efficiently process bilirubin, which is a yellow pigment made when old red blood cells break down. In most cases, it's temporary, clears up on its own, or maybe with some simple light therapy.
Okay, good to know. It's usually temporary.
Yeah.
What about their senses? How well can they see, hear, smell right at the beginning?
Well, their vision isn't fully sharp yet. They focus best on things close up, maybe 8 to 12 inches away, and they like sharp contrasts. They can tell the difference between bright and dim light and distinguish some colors. And interestingly, they even show size constancy.
Size constancy.
Yeah, it means they seem to understand an object is the same size even if it looks smaller because it's further away. Like, a car down the street is still a car-sized car.
Wow, newborns do that.
Seems so.
Yeah.
Hearing is working at birth, but the acuity, the sharpness, still needs to develop. But smell, taste, and touch, those are remarkably well developed right from the start. They can recognize their mother's scent. They prefer sweet tastes.
Fascinating. Some senses good to go, others still developing. And can they learn things right away?
Oh, yes. Remarkable early learning skills.
Hmm.
They can do classical conditioning learning to associate something neutral with something that already causes a response, like maybe they learn the sound of your footsteps means feeding time is coming.
Okay.
And they also show operant conditioning. That's learning based on consequences. If a certain behavior leads to something good, like milk, they might do it more. If it leads to something unpleasant, maybe less.
Like sucking harder if it gets them milk faster.
Exactly like that.
And habituation. I remember reading that term.
Yes, habituation is super important. It's basically learning to tune out. If a stimulus is presented over and over again and nothing bad happens, their response to it decreases.
Ah, like getting used to a ticking clock.
Precisely. It happens across all their senses, and it's linked to their brain maturing. It's
Right.
really efficient. Lets them ignore the familiar stuff and pay attention to new, potentially important things.
Makes sense. Helps them focus.
Yeah.
Lastly, the sources mention social competence. How are newborns social beings?
They really are, surprisingly so. They selectively pay attention to certain things, especially faces and voices. Their behaviors, like crying or making eye contact, often feel like they have communicative intent, right?
Yeah, definitely.
They respond quite systematically to what parents do. Their own behaviors tend to follow predictable patterns, alert times, sleep times. And crucially, they show this amazing ability to learn from and adapt to parental behavior. It's the foundation for social interaction, right there from day one. They also cycle through different states of arousal, deep sleep, quiet alertness, fussing, crying.
It's just incredible when you lay it all out. Everything that happens in those first moments, days.
Yeah.
From the hormones, starting labor, to what a newborn can already sense and learn and how they connect socially. It's just this huge, awe-inspiring transition.
It absolutely is. And the more we learn, the clearer it becomes just how complex and frankly wondrous this starting point of human life is. It really makes you ponder the long-term impact of these very first experiences, doesn't it? And how that dance between our genes and our early environment shapes us in ways we're probably still just beginning to fully grasp.